I'm Dr. Elizabeth Hobbs. I'm a mother of 4 teenagers and an emergency medicine consultant. What I am about to say is designed to help you cope with coronavirus infection at home. It's not intended to usurp or replace your own medical advice, as everybody has different needs. This video is intended for the general population who are otherwise well and who do not suffer from diabetes, heart disease, high blood pressure, immunosuppression and other chronic diseases. I cannot and will not be held responsible for anything that may arise in an individual's case, and if you're unsure of your symptoms, please use NHS 111 online or call 111. When you become ill with coronavirus infection, you may have a temperature of 37.8 or above, a continuous tickly cough, a sore throat and aches and pains all over the body. Some people may suffer a headache, a runny nose or diarrhea, and it's helpful to have a thermometer to measure the body temperature, as it may be difficult to measure a fever by guessing, looking at or touching someone, especially if you are tired or anxious. Now, 80% of people infected with coronavirus are expected to have a mild illness which can be dealt with by care at home. But approximately 20% of the population may attend hospital for treatment of shortness of breath and pneumonia. I hope that you will fall into the home group and recover well, and I want to concentrate on how you treat the early symptoms of the illness at home, because it may be that appropriate care in the early days of being unwell may help you get better without needing hospital admission. Now, inside the human body, coronavirus is working to a time frame. In approximately the first 4 days of being unwell, you'll suffer fever, a sore throat and a dry tickly cough. Many people need hospital admission after 4 to 6 days of fever because of shortness of breath and pneumonia that often begins in the middle of the night when their airways are naturally at their narrowest. These people may recover with oxygen therapy and some will require intubation, but in most cases the illness is expected to last approximately 7 to 11 days. If you're admitted to hospital, it could last substantially longer, especially if you need ventilation. Now, this fever of 37.8 or above in adults should be treated with 1 gram or 2 tablets of paracetamol every 4 to 6 hours. The maximum dose of paracetamol is 4 grams or 8 tablets in 24 hours, and do not exceed this dose. Take paracetamol regularly until you're well, as shown by a temperature of 37.2 or below. The good news is that when the fever is decreasing in an adult who has no other health issues, it may mean you are getting better day by day. Keep going with the paracetamol, as the fever may last 7 days or so. Do not use medications such as ibuprofen and aspirin to treat the fever. These drugs may make you poorly, so do not be tempted to add them in. I know lots of households have these in the cupboard, but they must not be used to replace paracetamol. For children, follow the instructions on the paracetamol bottle, and it's helpful for medical staff if you already know your child's weight in kilograms before you attend hospital. Some mistakes patients make taking paracetamol when they have a fever is taking it intermittently rather than regularly, and then rushing around because for a time they feel better. This is a definite no for coronavirus, because in the early stages of your illness, it is busy multiplying inside you, and it stands to reason that if you stress your body by exerting yourself, for example, having a long run or even just a long day, the virus may get the upper hand. It is sensible to have plenty of sleep, afternoon rests with your feet up to hip height, and sometimes walking about the house. We are human beings designed to move, but don't overdo it. It won't help you in the long run. Respect the fact that there's a battle going on between your immune system and the virus, and you must be a good patient at this time. It's harder than you think, especially with the family around at home. Very simple measures such as running a lukewarm bath, not topping it up with hot water, and wetting the hair will help cool the body as the temperature of the bath water cools naturally with time. Never put someone in a cold bath, it just needs to be lukewarm. Some people retch if they're given tablets when they're very hot, and this is when a lukewarm bath is helpful because it will help reduce their fever so they're less likely to vomit. Fluids also help bring fevers down, and the fluid to drink is water. Some people will like to sip iced water, so have some ice cubes ready. You can tell how well someone is hydrated by looking at the colour of their urine. If it is dark and smelly like our morning urine is sometimes, then you need to drink more. But if there's lots of urine and it's pale coloured, then you've done well. When someone is feverish, they often have a headache, and fluids may help ease this. People with high temperatures will not want to eat big dinners. They may barely want to eat at all. And if you think they need some sugar, then a fizzy drink containing some ice may help. People who don't need to lose weight may benefit from a liquid food, such as Complan or soup. Now for the tickly cough. Do not underestimate the nuisance of this. It punches well above its weight and needs addressing. During the day, it may just be irritating, but at night time, it may stop you sleeping, and this is a bad thing, as all ill people need more sleep. Prop people up on pillows, take a teaspoon of honey, it's a natural remedy that's very effective, or use a throat lozenge and let it dissolve naturally. Some people benefit from throat sprays, whilst others favour liquid glycerol from the chemist. If you suffer from a blocked nose, a nasal decongestant in spray or tablet form is helpful, and it stops you feeling so wretched. If you have phlegm, which is difficult to cough up, then an expectorant medicine from the chemist will help loosen this. Phlegm is better out than in. It may help you assess how someone is doing by knowing their resting breathing rate in a minute when well. When they're not looking, count how many times they breathe in a minute. On a wall chart, write everybody's names in a column and then write day 1 to 14 across. Record the date when each person starts their fever as day 1, and the household members may fall ill sequentially, or it may be that everybody gets ill together. This may be a confusing, frightening time, and a written record of temperatures when paracetamol is given and will help you understand where everyone is in the timescale of the illness, and it may help you communicate with medical staff too. Something written down will keep you on track so doses, temperatures and breathing rates don't get confused between household members. There has never been a better time for a healthy diet. Eating lots of fresh fruit at home, which is a high vitamin C content, such as oranges, may have antiviral benefits. This is not orange juice that's been open in the fridge for hours, as the vitamin C has long since oxidised and gone by then, but any actual fruit is a good thing. At this time of year, there's often not intense sunlight, and vitamin D is believed to boost the immune system. Remember, if the family is food raiding because they're all stuck at home bored, give them a glass of milk first before you hand out the crisps. Watch the amount of alcohol you drink. I'm sure the virus may see it as a weakness, and likewise, smoking is its friend, as both attack the lungs. Coronavirus punches harder and longer than flu. It can cause a pneumonia that requires a hospital admission for shortness of breath, but even if you are getting better at home, there is a chance that a secondary bacterial infection could cause a chest infection. This may be spotted as green or yellow phlegm, which will require antibiotics, and if people are short of breath, it's time to seek medical advice urgently. Don't wait until tomorrow. Take care of each other. Treat the fever and the cough, encourage fluids and rest well. If you hear someone coughing at night, get up and help them. Bring them water, puff up their pillows, take their temperature and give them some paracetamol and other medicines. Don't just roll over and go back to sleep. If they're not coping or you're not coping and they're ill, use the NHS 111 online, call 111, or in a medical emergency, dial 999. Be kind to yourself and go gently into the recovery stage. Don't go straight into full activity. Walking in the fresh air, still 2 metres apart, as the Prime Minister has suggested, is surely a good thing to do. But not challenging runs or cycle rides. Be creative, enjoy the garden, don't stay still continuously, move as it is good for your mental health. If you have recovered, you should have immunity to the coronavirus, and this is what we are expecting for the majority of the population. So remember, if you are struggling to cope at home with a fever of 37.8 and a cough, or just shortness of breath, use the NHS 111 online coronavirus service or call 111. For a medical emergency, dial 999. I would like to thank relatives, friends and colleagues who've helped in the production of this video. Please take a moment to reflect upon the bullet points that follow. Thank you.